Yeah, I'll just say thanks. I'll just say yeah, I really appreciate having you guys join. One of the nice things about this group is that we get to bring a lot of very interesting speakers and guests to come share the work that they're doing. And so it's as Carl said, this is definitely a very engaged group, and look forward to hearing more about the Kindness Coalition. Thanks.
Excellent. Okay, with that, I'll go ahead and hand it off to Amity and Prerak to present. And really, we're pretty informal on timings. I know somewhere between 20 and 30 minutes should be fine, and then leave some time for some Q&A for us. And if we get to the last part, that's fine. If we don't, no big deal. We're flexible there. Okay, so take it away.
Oh my God, thank you. This is amazing. I can already sense the engagement, so I really appreciate it, and I'm sure we'll get a chance to really hear all your thoughts and get a chance to share what we've been working on. So let me just share I think you already can see my screen, hopefully. And why am I? It's gonna be under view, right? There it is. All right. So we are the Kindness Coalition. Everyone can see my screen, hopefully. Thumbs up. Okay, perfect. And I'm going to get into the basics, and then I'll hand it off to Amity, who's my co-founder. My name is Prerak, like before the rack. I'm a second-year internal medicine resident, and I'm really excited to share a lot of what we've been doing. So I'm going to start by framing the problem. The first one is the aspect of burnout, which anyone in healthcare is all too familiar with. The second one is a little bit more specific to Stanford, and it's this aspect of silos. And anyone who's worked at Stanford knows that we are exceptional at what we do, but that also means that we're very specialized. There's a specific place where we admit lung transplant patients, heart transplant patients, nephrology has their own service. And so because of all of that, we're good at taking care of patients, but it does make it harder to be cohesive because there's so many different places that people can be, and it's hard to kind of know the people behind the certain specialties. And the last aspect in healthcare that can be sometimes difficult is this aspect of asymmetric rewards. In healthcare, it's very, very easy to know when you miss something. You will know every time that you missed a patient who had a pulmonary embolism and you couldn't pick up on it. But unfortunately, it's very hard to acknowledge the times when things go right because you often avoid something, right? So you may not know the 9 or 10 PEs that you save by putting a patient on anticoagulation, but you may know that one time you actually did miss a diagnosis that you didn't get right. So this is this aspect of asymmetric rewards, which is kind of hinting at we need to kind of level the playing field and show people that there are a lot of good things happening in healthcare that we may not get a chance to acknowledge. So the inspiration for the Kindness Coalition came when Amity and I were both on nights as interns, first year in the hospital, and we were so overwhelmed. And yet the nights that we felt the most fulfilled were not the nights where we did the best patient care or maybe felt like we did the most for the patients. It was actually the nights where we got comments like these, where someone actually said, "Hey, it was great working with you tonight," or "Thank you for all your help." And hearing comments like that really go a long way when you're surrounded by what can sound very overwhelming every single day. And it just takes that one comment to say, "Hey, it seems like you're having a tough time. Can I make you a cup of coffee?" And those days are the ones where I'm like, wow, I really am grateful to be in this profession. So that's where the inspiration for the Kindness Coalition came from. When we created the Kindness Coalition, our goal essentially was to create a system that encourages and identifies kindness in daily communications and actions. And the reason for this, again, is to level this aspect of asymmetric rewards. We want to show people that, yes, it's a very stressful environment, but sometimes the small things that we do go a long way in helping us take care of ourselves as well as each other. The second thing was we wanted to bring individuals together across departments and professions invested in promoting kindness. And I mean this to address that aspect of silos that I brought up earlier, right? I want to be able to talk to the case managers. I want to be able to talk to the social workers. There's so many people that come together to help care for patients. And anyone who has ever been in a hospital or even discharged a patient from a hospital knows that there's so many people involved in that patient journey. And getting a chance to have all of those people on the same page is always a big way to provide ultimately value. And the third one is to find ways of rewarding acts of kindness. And the way that we're currently doing this and Amity will get into it, is we're trying to send formal emails to healthcare workers who end up doing something positive. So let's say I work with Amity and she maybe did something that really made me feel valued. We have a very small kindness form that people can fill out, and the person who then gets acknowledged gets an email sent to them. And we also often CC the supervisor. And the reason we're doing this is to kind of show people that we really value these sorts of small interactions and trying to find ways to kind of bring that to the table. And the last thing is, if we do numbers 1 through 3 correctly, we're hoping that we can create a network of individuals who are invested in building a strong culture of kindness and collaboration, which ultimately will help to provide more appropriate patient care, believe it or not. And I think that's ultimately the big goal at the end of the day. And so I'm going to hand it off now to Amity because we are still residents and we tried to approach this in an academic way. And so kindness can sometimes be very vague, but we have a very nuanced approach as how we're trying to go about doing this. And we actually just had our monthly event today. We're both coming from it. So we're excited to kind of share what we've been doing, and I'll hand it over to her. Amity, all you.
Hi, everyone. Can you hear me okay? Good. Okay, so how are we actually carrying out the Kindness Coalition? How do we encourage kindness and collaboration in daily interactions among healthcare workers? We decided to take this four-pronged approach. First of all, we wanted to have a setting where we could bring healthcare workers together across professions, across departments, to enjoy snacks, have shared food, and talk about why kindness matters. So we created these monthly meetings, which I'll get into a little bit more. The second piece, like Prerak talked about, is really kindness recognition. How do we offer positive reinforcement for kind behavior? How do we support this type of behavior and show that we value it and make people feel celebrated for engaging in this intentional behavior? Thirdly, having a communication platform between events. And then finally, creating a kindness toolkit to guide kind behavior in day-to-day interactions. So first of all, our monthly meetings. We actually had our 7th monthly meeting today. And at each of our meetings, we've had over 100 healthcare workers. Today, actually, we have over 150 healthcare workers with a variety of departments in presence, from internal medicine to psychiatry to OB-GYN to trauma to palliative care, really across the whole gamut. And our monthly meetings are an opportunity for healthcare workers to just come together, to hear about what we're doing, and to really talk about why kindness matters. We've received really positive feedback from the start when we first implemented our monthly meetings, and we've really heard them from across different professions. They highlight the fact that these events serve as a platform where people can come together without the titles, without the hierarchy, enjoy food, and really think about how do we treat each other better, not just during the good moments, but during the really stressful moments, right? How do we take this intentional approach that not only transforms our own wellness, but really transforms patient care? This is an example of our kindness recognition form. You can see the QR code here, and you're welcome to pull it up on your own phones if you want to. The idea was, how do we create a system for positive reinforcement that is very accessible, that there is a low activation energy for? So we created this super quick form. You put in the name of any healthcare worker in the hospital who's positively impacted you through kindness. You put in a brief comment. They receive an appreciation email, their supervisors included, and it has been unbelievably heartwarming to see the chains of emails where people are just complimenting somebody on their kind behavior, on these super important little things that people are doing every day that normally don't get recognized. Over time, our kindness recognition form submissions have continued to uptrend, and this is just the first 10 weeks, but we have seen this trend continue onward. And this is our WhatsApp group if anybody wants to join. Really just a place where we can remind people about events, or we can offer tips and tricks. Once our toolkit is done, we'll share this in the WhatsApp group as well.
And sometimes we also use this as ways to link into existing events. So like Nurses Week, we try to say like, hey, it's Nurses Week. If someone has a nurse they work with, give them a shout out. And similarly, like Resident Weeks and Doctors Weeks are also ways to kind of engage.
And then this is an example of our kindness toolkit. These are the principles that we are basing it on. This idea that we're all one team, this approach of valuing those around us, remembering to be humble and build an inclusive environment, respecting those around us, and of course, recognizing that we're all human, we're all going through this together. We're all in this together to take care of patients and to take care of each other. And we're super excited that we are now officially collaborating with the CI Care team to turn these principles into guidelines for behavior. So importantly, Prerak and I, when we were on nights, we really found that there were these important principles, these important themes that were transformative in our experience. And when we really thought about what is the definition of kindness, we realized that it's really behaviors that lead to positive interpersonal connections. And if you look through the literature, while there isn't a lot about kindness within the healthcare setting, it does really point in that direction. And the question is, how do we create these positive interpersonal connections? And that is what we're trying to build, right? In these everyday interactions among healthcare workers, whether it is 30 seconds or 20 minutes, creating that positive interpersonal connection is possible. And it's really essential and makes a whole difference. If you do look at the literature, there is important literature on kindness, and it is limited, but it points to the impact, not just in the healthcare setting, but in any work setting. We know that kindness builds community. It promotes collaboration. We know that it decreases burnout. And importantly, it actually cultivates resilience in the actor of the kind act. And there is this awesome theory called the upstream reciprocity theory that the receiver of a kind act is then more likely to engage in a kind act themselves. And so our goal really is, if we can get a large enough subset of our community to engage in this intentional behavior, we can really shift culture over time. And big picture, as Prerak said, we believe that this can truly impact patient care. We've seen it ourselves. When we approach behavior in this way, we are more collaborative. We come up with better decisions. And importantly, we are also more efficient. So we know it improves patient care. We know it contributes to wellness. And we really believe it can help reduce burnout. For next steps, we are integrating the Kindness Coalition, which is TKC, into existing structures, now working with the patient experience team, working with the Department of Wellness, and really continuing to think of this as quality improvement. So now we're starting our next PDSA cycle, thinking about how can we expand this and how can we make it even better, even more effective. We are so grateful for all the incredible support we've had from truly across the hospital. And from the start, it's been very inspiring to see how many people want this, how many people want to shift our culture further in this direction. So thank you, everyone. We have a lot of QR codes here, but if you're interested in joining our leadership team, if you want to submit a kindness recognition form, join our WhatsApp group or follow us on Twitter. Here are all the QR codes, and that is an example of the flyer for our event that we had today.
And I'll just end by kind of reiterating a lot of these fundamentals, which is it's odd because we talk to a lot of people who are parents. Unfortunately, neither of us are parents now, but one of the resounding themes is parents always say, including whoever is in healthcare, that one of the biggest lessons that they've taught their kids, including myself from my parents, is to just be kind. And it's funny how we often forget that as we progress onwards, especially in a setting like healthcare, where I think we are always taught to be kind to patients. And of course we would, that's the profession. But sometimes we often are not as kind to each other, despite knowing all that we have gone through. And we often can both relate to each other. And so that's kind of the goal, this is not a patient facing endeavor, even though we think it will improve patient care. This is more of a behind the scenes culture change endeavor. And I think everyone always gets nervous when we say culture change because it is such a big task, but that's kind of what we're doing. And I think one of the things that really sets this apart is that it's not a top-down initiative like Amity and I are residents. It's a more of a bottom-up initiative. Like we genuinely do feel like we're in the hospital a lot, and some of these fundamental things are things that we think will help shift culture. And that's why we think the resident-led aspect of this is really important. So we're always recruiting more residents across different fields. I saw we had some pediatric leadership here, like pediatrics is another specialty we're hoping to slowly engage with. And as we continue to kind of keep that going, I think we really do have a way of hopefully addressing culture in a positive way. So we'd love questions. And again, thank you all so much for your engagement. And we will definitely reach out to all of you for our next event. We'd love to see you there and give you all little fancy pins, as you can tell that we are repping on our badges.
I have my pin
Oh, yay!
from the Nurse Week event, and share with them your grant that you just got. Didn't you just get a grant?
Well, we have one grant that we were actually we won an award at the QI Symposium,
Okay.
which we were really proud of, because one of the biggest contributors of that award is that one of the judges was one of the environmental services leadership board, and she was mentioning how the 2 units that we're piloting Kindness Coalition on, which is B3 and C3, are 2 of the units they have started seeing a significant change in culture in. And this is anecdotal, but it was pretty insightful for us to hear, because they were saying that when their workers go there, the nurses were actually explaining things to them. They would call the doctor in to help explain nuances of why someone would be on contact versus not contact precautions. And they were just saying how that was like a breath of fresh air. And that just felt great to us, because again, that unit in and of itself is already a great unit, but it was nice to know that a lot of the initiatives that we've been doing have been on that unit. And it really felt heartwarming to know that this is kind of headed in a positive way.
Can you talk more about, you mentioned you've had some interaction with the wellness office, and I'm just wondering, did you mean Tate Shanafelt, or because that's definitely hardwiring that should
Lots of
occur.
lots of people in wellness, which we're so grateful for. Yeah, we've been talking to Tate Shanafelt for since about January. That's when we first connected with him. We received the Wellbeing GME grant, and I think that may be what you were referring to, Gisso. And we recently also have been meeting with Dr. Weinlander as well. And we're actually going to be presenting to the well-being directors this Friday. So lots of things happening on that end. Prerak, add anything I didn't mention.
Yeah, mostly the GME and Dr. Shannon-Felt are the 2 big ones, but GME, Dr. I think Dr.
Blankenberg.
Blankenberg,
Becky.
I call her Becky. But yeah, she's been really big advocate of it, and she's come and support our thing, our poster. And I think Dr. Shannon-Felt has been really helpful in helping us meet the right people.
And Katie works with Becky too.
Yeah, do you think that Neeraj is as aware of this as Tate is?
Yeah, we met with him actually. He was very excited. We were very excited that he was very excited too.
And the cool part about Neeraj is that he actually said that he has started his own like newsletter, which is fantastic. And he always signs that newsletter off with be safe, be smart, be smart, be kind. And it was just so coincidental, because I think he had created that during the COVID-19 pandemic as one of the 3 pillars of what should kind of keep our community together. And it was nice to hear like the be kind aspect, because as I said, it's such a good theme to hold on to.
I had the pleasure of meeting you both at the event last week, and I have my pin, and I'm really excited about this. And I was wondering, have you had a chance to talk to Dr. Speck at Tri-Valley? I mentioned it to him, told him we need this here, and he said I think he said he was going to be catching up with you.
I am actually going to be starting at Tri-Valley on Tuesday, next Tuesday. And Dr. Sweck and I actually met recently. So yes, I'm going to email him. And I think the good part is, because I'll be at Tri-Valley starting next Tuesday, hopefully I can hit the ground running by getting some of our basic flyers there where we can give shout outs to each other. And then also trying to get a few more of the hospital leadership involved, because I definitely think Tri-Valley would be a fantastic place to have a lot of these initiatives and even have an event in the future.
Great. Well, Suki and I were both there, and we talked about this like all the way home. So I think I feel comfortable speaking for her that you can count us in.
We are 100%. That is 100% in the plans. And we will keep you both posted. We are very excited about that.
I was going to show my flyer that I keep very close by to me right over here.
Amazing.
So, yeah,
We
I
love
came back.
that.
I was like, can I sneak this out of the building? I think I can, but it's my reminder over here. And absolutely.
If you Amity or Prerak, if you would like to write an article for the SMCI newsletter, if you want to do one in the next couple of weeks, that's fine. If you want to do one for July, we'd be happy to feature you in the SMCI newsletter as well.
We would love that. Thank you.
Yeah, I also wonder if there's an opportunity to put the link in the submission. So as you guys know, we have our safe submission area, right? And we are very intentional for putting right next to it BIOS, which is for professionalism. And although it's intended, for issues around professionalism, we also, and maybe a lot of people don't know, we want to encourage people to put kudos in there as well. But unfortunately, it's more known for putting issues. So I almost wonder whether that might be a natural area where you have your safe, your professionalism, and then the kindness, link to it that people can go to. So yeah, maybe offline we could kind of explore if that's a place to also put it. But it's so far, as you can see, like there seems to be a lot of enthusiasm and support, and people are already, the wheels are spinning, right, in terms of how this can be incorporated or how you can leverage or make different connections. And so just again, I know everybody's already been making comments and feedback, but yeah, I'd love to just take a few more minutes, just open up any other questions or thoughts or suggestions for Amity and Prerak.
I have a quick question for you guys. It's amazing work, and it's dealing with a sort of probably an underappreciated gap. But I was curious. You said that you had mentioned, I think maybe on your last slide or second last slide, that you had some CSRP support. Can you talk a little bit about how you made a business case for this?
Oh my God, yes. I have an MBA. So that's I was lucky enough to do an MD MBA. But the business case support and the CSRP funding for this one actually came from Dr. Sweck and Dr. Shea. So Dr. Sweck and I were well acquainted, and then Dr. Shea helped with the QI aspect. But the business case support for this is the aspect of, I think when we have better cohesion among team members, I think patient outcomes improve. Sometimes length of stay decreases. And ultimately, I think patient care is better and patient outcomes are better. And actually, in a longer form version of this presentation, which we didn't get a chance to present, we actually talk about a pretty interesting anecdote that I had on nights, where because the nurse and I had acquainted ourselves so well with one another, even though I felt very not as prepared as a baby intern, she and I were able to identify a pulmonary embolism in a patient earlier. She was able to call me much earlier than she would have because there was this aspect of psychological safety. I had already gotten to know her, and so I felt like her sense of urgency a little bit more readily. Because of that, I then got the scan. The scan got protocoled much faster. Once the scan came back, she let me know right away because she was following the case and she felt easy to reach out to me. And then we were able to reach out to the ICU team, and the patient got triaged much more effectively. And the feedback that I had gotten there is like, oh my God, we have very rarely had a patient get escalated this quickly and appropriately. More often than not, the scan gets done. There's a little bit of a delay. The nurse doesn't know the scan is back. Sometimes it doesn't get communicated with the other team member. And every step of that was much more streamlined. And because of that, they ultimately patient got the care they got. And then similarly, you can see small anecdotes like this where when a case manager feels more comfortable reaching out, and we all know that we're one team, discharges happen a bit more faster, length of stay is lower, and more importantly, less errors get made because when things are confusing, people reach out as opposed to just holding it in, and you have fewer near misses and fewer errors in my in my anecdotal evidence, but I think that's the case that we made by actually creating a culture where everyone feels accepted and knows that they can reach out and knows that we are all one team and has that aspect of humility and knowing that we're all trying to do the same thing at the end of the day, even if we have differing opinions. Patient care is better because of it.
And I think the other piece too is healthcare worker retention, right? As we shift our culture towards being more positive, inclusive, supportive, we can retain healthcare workers for longer.
I apologize if I missed it, but is there any, has any of this reached over to the Packard side? And if not, is there a plan for spread or how to get some key stakeholders on board initially?
We're trying to actually reach out to the Packard side. So we would love if you have any good contacts. Right now, the biggest ones that we've been kind of utilizing is actually Becky because she is a pediatric hospitalist. And we were going to utilize her as a way to kind of find good places to reach out to. But unfortunately, because we have kind of met mostly with the 500P and 300P leadership, it's been harder to kind of break into LCPH or LPCH.
Let me think about it. I have a few people in mind. I know that we have a robust process of like rewards and recognition, making sure that we don't have duplications and things along those lines. I don't know who leads that group. I believe it falls under our shared governance, but I could ask around and because I know that there would be great enthusiasm around this. It's just a matter of how and how it would integrate with our other structures. But this seems like I don't know who wouldn't want it outside of just figuring out how it can, run smoothly alongside our other recognition programs.
Yeah, absolutely. And we've actually been able to integrate into other departments, but I think getting into Packard was like the next thought as well. And even in outpatient setting, that's also on the horizon.
Yeah, I mean,
Also,
if you send me your slides, I can certainly get them to Grace and Terry Karthik. I mean, could do the same, and there's a couple of other hospitalists at least I could share.
That would be incredible. And we really do want to integrate this into existing structures. If there is like an organization or a part of the hospital that already has its own recognition forms, like please use those if they are working. Our goal is like shift behavior, shift culture, and that looks different sometimes in different units, right? It looks different in different parts of the hospital, and we want to be very thoughtful about how we approach that.
Great, thank you. If there are no more comments or feedback, again, thank you so much for coming to share about your work.
Sam, I just got to ask, how do you get 100 people at the same place at the same time? And like, how did you have room for 100 people to do something? Is it outside? Or I'm just curious how you did that. We can barely get 60 people on a Zoom for a lecture.
I think there are a few pieces. First of all, we figured out very quickly that it has to be on unit. This is not possible if it's off unit. Attendance has to be flexible. People need to be able to come for 1 minute or 30 minutes if they want. There has to be boba or some type of food that brings people joy and is caffeinated. And I think you really you have to reach out to your stakeholders and you don't need a ton of stakeholders, but you need stakeholders from different professions and you need stakeholders from different departments. What's been really incredible is that over time, we've had to promote these less and less. I mean, we got 150 people today and we only sent out a handful of emails really. And they were from across like tons of professions, tons of departments. I think it speaks to the fact that people need a moment to step away. Like they want to have that time to step away, grab boba, and be in like a positive space where we're talking about the importance of culture.
And it's not always like 100 people at once. The beauty is that they come in at like 5-10 at a time. Sometimes they'll come in, they'll grab a drink, and then they'll literally see our flyers. And I'd love to send all of you like the photos from the event today, but the way it's set up is like flyers of who we are, the sign-in code, a little QR code in case someone wants to give a shout out in the moment. Then we have our boba. We have a little board that literally says, what does kindness mean to you? It's really aesthetic. There's a Post-its on it and people can fill it out if they want. And as they're kind of making their way out, there's a few kindness pins. And so they're getting their food, but in the process, they're seeing all of these other things. So that usually most people will be like, what is this? Or if they already know about us, they'll say like, oh, wow, this is awesome. And they'll actually take some time to fill out the little sticky note. And so that aspect of just kind of the little small nudges we have for people is like, as they're kind of even going over to grab a cookie, they're seeing that little board in front of them, or they're seeing like the About Us laminated slides. And some of the slides are literally the slide deck you all just saw, but they're just laminated and they're on the side. So people kind of know our values and what we stand for.
It's really incredible. I was just reflecting on like Stanford's such a great place to be, and it's full of the smartest people, the most driven, type A, OCD, and like we really do a lot of great work. But this really kind of pulls back the human aspect of it and be like, we are human, we need kindness. That's what feeds us and drives us, in addition to caring for our patients. So it's a real nice kind of warmth to all the great work that we're doing. And I think we need to be intentional about infusing that back into the workplace.
And so sorry, you guys got me so excited. Can I just share my screen one last time? I just want to show you this. So this is the photo from today. Just so you can kind of like see what I was talking about. So like, you can see like we have our flyers, a bit about who we are. Here's our boba. And then these are the cookies, and the sign-in code as well as the acknowledgement for a healthcare worker is right in the front. And then what does kindness mean to you? And this is all before the event. I wish I had an after, but like this board was filled with the stickies with like what people wanted to say, what kindness meant to them. And then this was a bit about us. And then people like gave shout outs. And I'm sure if we looked at our survey, we had like at least 10 or 15 people fill out, like give a shout out to someone else. So that was nice. So like, it's just kind of, this is kind of the setup and people kind of come in and go, just to kind of put a picture to everything I just said. But thank you so much for asking that. Got me really excited.
What I love is that you've broken the sort of hierarchy, you've level setted, you've created shared mental models. I really appreciate all of the thought and the work around this. So thank you. Thank you both. We're inspired.
Strategic placement of the cookies behind the poster too. You got it.
Nudging.
Oh, great. Yeah, thank you so much. This is wonderful. I have one question, and then I would like to just wrap it up. But the question is, so when you do these events, is there so people come and go? So is it about getting them to just mingle with one another, or do you have a topic you talk about, or like is there ever a part where you're sharing with everyone, or is it just a time for people to connect?
So people come through in groups, which works out really nicely. Right. So they'll come in groups of anywhere from like 10 to, I think at most we've had like 40 people in that room, which is cozy. Depending on how many people are in there, we'll either speak separately to groups or we'll actually give like our spiel to the larger group. We like to incorporate an activity where we just have people introduce themselves to one another. If there are enough people in the room, someone they've never met before, which is really nice because there's like this moment of quiet and then people turn to each other and all of a sudden the room is like bustling with people talking to each other who have never spoken to each other before. And also, like Suki said, really breaks down that hierarchy. But we sort of feel out how people are feeling as they come into the room. We give them pins. We give them a way to engage, whether it's through signing in or through filling out a kindness recognition form. And we talk about what we're doing. We talk about why it matters, how it impacts our daily work as healthcare workers, and how it impacts our patients.
So good. One of the things that we've tried to do with this group is discuss the concept of psychological safety. And this seems like it's really getting to a lot of that and breaking down the walls, hierarchy, the one team aspect, all of it. I think it's really good. And I appreciate that you shared it with us and that you're leading the way in this. So it fits perfect with what we're after here. So thank you. This is really great. So we're at just about at time. I've got 2 minutes. And so for those who are new to us, what we try to do at the end of all of these is wrap it up with a little mural exercise where I put the link in the chat. What I would love for you to do, we don't have time to go through all the past comments, but you can go to this. It has some of our past comments, but what the other thing it has is, so we'd like you to add what you liked about this, what you wished we had maybe done or discussed, and then what you wonder we might want to do. So I like a wish, a wonder. Take a moment, jot a few things down. It's our way to receive feedback and know how to make this better next time. If you go ahead and do that, feel free to drop off when you are ready, but the link is still live, so you could use it from now for the whole month if you wanted to, till the next meeting. So wonderful. Thank you so very much. This has really been great. Let's give them a little round of applause, if you would. That was wonderful. Thank you so much.
Oh, thank you all so
Okay.
much.
Yeah, wonderful. Thanks for joining with us.
Thank you.
Okay, well, go ahead and wrap it now. And please, yeah, give us the feedback on the mural if you can.